Welcome to Street Talk. I'm your host, Loretta Rose. We are on location today in Columbus at the Columbus Civic Center. It is a Tri-City Health Fair, and it is free. It is open to the community. It is an annual event. We're going to take you inside, and we're going to find out who's responsible for bringing this together. It's going to be great. Thank you for tuning in. I'm talking to Pastor Clyde with Tree of Life Healthcare, who is responsible for bringing this wonderful resource health fair here in our local community. Pastor Clyde, thank you so much. And Dr. Clyde, many call you as well.
Yes, thank you for having me.
This is wonderful. It's a resource center.
It is. And we pull together a lot of different resources within the medical community. It's about preventive health care and also screenings and save lives. That's part of our theme this year, is that screening save lives, and it does.
It does, exactly. And the people are very appreciative here that are present today. I want to know and help the community to understand more. Before we talk about some of the various health professionals that are here, how did this vision come about?
Well, about 3 years ago, after my second colon test, I was 50 when I took my first one. The second one at 60, the doctor stopped in the middle of the exam because it was a mass there. I found out that it was cancerous. We did a CAT scan to make sure what we were looking at. The CAT scan showed that I was not only had colon cancer, but I also had liver as well, and possibly my lungs. And I had no symptoms. So we did a MRI, a PET scan after that to actually identify what the cells were. And it shows up bright yellow on the screen, so you know where they are. And so after I went through the process of healing, consulting the Word of God, standing on the Word of God, and also the process of, because he said even though they did the surgery, after prayer, of course, the doctor came back in and said, this is rare. It has just localized one spot in your colon and on the periphery of your liver. With surgery, we can go in and remove the diseased tissue, be cancer-free. But it also says 6 months of protocol was 6 months of chemotherapy. I did that through the process. But after going through that process, realizing that there are some people who don't have access to what I have access to, as far as the PCP, different screenings and different things that we take for granted. And so why should I have availability of those things? My other brothers and sisters in this community does not. And so we started the annual health fair to avail those screenings to individuals so they can know their numbers. If they do have a chronic condition, then we can there move forward to taking care of them, especially for those who have no health insurance and they're underserved. I tell you that you have high blood pressure or you have a liver disease or something that's going on with you, but then said that's it. We can't leave it there. So when today it's just about the health fair, screenings and things like that, but also about what we do beyond today. And taking those individuals that don't have health insurance, are underserved, then Tree of Life become the medical home for them.
Wow, medical home. Yes. So, someone probably watching and want to know, how are you able to do this? How are you able to provide, this type of treatment or free health care in the community? I want them to know how they can help as well. Is there any way that the community can be involved in affording people this opportunity as well?
Absolutely. It's not just about this day. It's also about the continuation of care for our patients. But at Tree of Life being a charity healthcare clinic, we serve people that primarily have no health insurance and underserved. But because of those individuals that are in that predicament, without health insurance, without the means to pay, we just can't send them on their way. So in order to continue to provide that service to them, we need help. So we ask those of you that listen today to go to our website at www.treeoflifehealthcare.org. That's www.treeoflifehealthcare.org. We have a $20 a month partnership program that allows us to continue to provide the services for our patients who need that care. And so we want to thank you in advance for helping us help those who need our help and deserve our care. But we do need partners to be able to continue to work beyond this day.
Absolutely. So, yes, we have a lot of great people in the community that can come on board and be partners with this. And I've seen people, as I was coming in, they are appreciative of this.
And we thank God for allowing us the opportunity to be able to give back to our community. Because at the end of the day, it's about family. And at the end of the day, it's also about are we our brother keeper? And the answer to that is absolutely. We have to be concerned about everybody in our community, especially in this day and time and the climate when it concerns the affordable health care, other things going on in the legislative branch. We're concerned about that, but not to the place where we can't do anything. So what can we do to fill in the gap to allow those individuals to live a long and well-satisfied life?
Wow. So, as we get ready to get a tour, our viewers are going to get an opportunity to see what's happening so that they would know the next time you have this, because this is an annual event.
It's an annual event.
So kind of give us a glimpse of what we're going to see when we make this tour.
Well, we're going to be doing the dental screenings. We're doing also sickle cell screenings. We're doing HIV Hep C. We also will be doing upstairs. We're doing the medical station, doing the PSA. Prostate cancer, checking for that. Also checking for high blood pressure, checking for glucose levels for diabetic, pre-diabetic. No, if you don't have it, that's great too. And doing, of course, vision screening is also. But so we try to be as comprehensive as possible to avail all those things to individuals and their families. Of course, need to have those things done.
Absolutely.
But that's just some of the things you'll be looking at today.
Absolutely. Well, thank you so much,
Thank
Dr.
you.
Clyde
Thank you. Appreciate
and
you.
Dr. Clyde. Well, you're watching Street Talk. We're here at the Columbus Civic Center. It is the world greatest health fair that you can ever attend, and it's right here in our Tri-City area. You're watching it here on CTV. So we're going to give you a tour of what's happening here at the health fair. So when everyone comes into the front entrance here at the Civic Center, of course they will come in and sign, fill out a waiver form, put pretty much their basic information so that once results come in, the health professionals here will contact them with the results. This is really amazing. And again, I would say it is F-R-E-E. I cannot spell it any better. It is free. So we're going to give you a tour and we're going to take you inside of the arena so you can see some of the other health partners and community professionals that are here. And now I'm talking to Miss Lois Williams, and we are in here where the sickle cell testing takes place. I've always wondered how, they find out if you have sickle cell. Yeah. So, Miss Lois, let us know about how can people find out? Because I'm finding out a lot being here at the health fair.
All right. Well, actually, in the state of Georgia and many states across the nation, all babies are tested for sickle cell trait at birth. However, sometimes people lose track of those records and may not know. So there is a blood test for it, and that's what we're doing today. And it can either be through a finger stick or a full-blown blood test that's done. And they find out that way whether they have the sickle cell trait and or the disease. So each year, our association does free testing at our walk, which is in September, and that's National Sickle Cell Disease Month. And these kind people from Atlanta comes down from Sickle Cell Foundation of Georgia, and they perform that testing for us. Now they're here today as part of the Tree of Life Clinic, healthcare clinic health fair. And so we got them and asked them if they would come back down this year to do the sickle cell testing at this affair today.
Wow, and he's performing the test now. And tell us this gentleman's name.
This is Mr. Harold Dobbins from the
Okay.
Sickle Cell Foundation of Georgia in Atlanta.
He's so gentle. So it's nice to know. So people that are watching, So 15 days?
Yes, they're testing today. They'll get the results in the mail. We send it to them, so they have
Okay.
that record.
Wow.
Uh-huh.
So people that are watching, it is just that simple, just like a stick. And in 15 days, you will get your results. That's that's simple.
That
That's
is,
easy.
it's very simple, and it's medical information that we need to have, especially people of color, because this disease affects us more than any other. It does affect other ethnic groups, but it's more prevalent
More
in
prevalent.
people of our
Yes, ma'am.
race.
Absolutely.
So we really stress the importance of them knowing their family medical history. And knowing so many of them don't know whether they have the trait or not. So we encourage people to come out, especially during those 2 periods of the year when the testing is free.
Exactly.
Okay,
Exactly.
so we arrange through our Association of Sickle Cell here in Columbus that people know where to go to get
Okay.
tested throughout the year.
Throughout the
They
year.
may have to pay a small fee,
Yes.
but they can get it at the Tree of Life Health
Yes.
Clinic and also at the Public Health Department.
Absolutely. What are some symptoms of sickle cell, though?
Well, sickle cell disease affects the whole body because what the blood cells do, they sickle. That's where the name comes from. Instead of being a round, pliable object, that red blood cell, when the disease hit or they have a crisis or are affected in some way, that blood cell changes shape into a sickle form. But it also has little areas in it that it's become sticky and it won't flow through the blood cells as fast or as it should. So then it clumps up. So just think, what happens is if your mouth was closed, you couldn't eat, could you? Your body couldn't get nourishment. So if it clumps up and cuts off that blood cell, that blood vessel, then it can't get nourishment beyond that point. That causes a person a great deal of pain, and it also, because of the lack of that oxygen and nutrients in the blood, that it can't flow well, then that part of the body is affected because it's not nourished. That's why a lot of organs in the body can be affected. People, the growth is stunted. They may have all organs in the body is affected in some way. So if it says the liver or whatever, then they have jaundice. You've seen them with the yellow eyes and so
Yes.
forth. If it stops off in the joints and the person have a lot of joint pain, in any event, it's pain.
It's pain.
It's pain, and if they have respiratory distress, acute chest syndrome. The legs didn't get the circulation and the blood nourishment it needs, so then they may develop leg ulcers. So it's a lot of different things that could affect the person because it affects the whole body.
Wow.
And it's devastating. It's excruciating pain, and when they get in a crisis, they need help.
Wow.
They need help.
I've heard of it, but did not understand it
Yes.
to this magnitude. And we thank you for educating us on
Yes.
that because I really don't think we get enough education. But it is available. Let me correct that. It is
Available.
available, but people are not grabbing hold to it.
They're not. We got a lot of work to do, a lot more work to
Exactly.
do, but we're trying. And the
Wow.
Association of Sickle Cell is here to help do that
Wow.
in the community. Anytime someone needs us to come out and speak to them about it, we're
Okay.
certainly willing and ready to do that. We try to hold different forums in the city, youth and support group meetings to get the information out.
Absolutely.
Through our medical facilities, the hospitals, the doctor's offices, and so forth, they all need this information, basic information and current information
Yes.
about sickle cell disease.
Wow. Well, we've given you a lot here. You're watching Street Talk, and we want to thank Ms. Williams and the wonderful team here for allowing us to come in here and the patient that allow us to come in as well. Preventive care is powerful. Take this information and apply it to your life and pass it on. You're watching Street Talk. Also, we want to thank New Horizon for being a partner here as well. In this room, HIV testing and hepatitis C testing is taking place in here. Those testing are just as much as important as getting diabetes checked, being checked for diabetes, also sickle cell, all of those. It is so important. So again, people can come here and get testing in here as well. I can never stress this enough. Prevention is powerful. And sometimes people may have illnesses and just don't know it. So this is a blessing in the community to have health fair with free screenings and testing. I want to thank all of the sponsors. I'm talking to Valerie Boggs here with Darkness to Light. I've never heard of it. Help us to understand more about this.
Okay, Darkness to Light is designed to end child sexual abuse. And we're spearheading this program through the Building Toward Wellness Community Coalition, better known as BTWCC, and we try to reach out and provide these prevention training sessions to any and all organizations and individuals in the community.
Wow. And it's so important to have children health as well. So they do have all of that here. Tell us again about, because you mentioned something to me about helping people to understand tips with children.
It is so important because unfortunately it's prevalent in our community and it happens, and it's important that you receive the training so it'll help give you tips and awareness on things to look out for, red flags or signs. A lot of times children don't tell what happens to them, and quite often it happens at a young age. And sometimes kids might be threatened or something. So as an adult, you can look at different symptoms that a child might be displaying, or it just help you with awareness. And that's what's important, awareness. If you work with youth in any manner, whether they're your own youth, you're in a church, you're in a school, the family, and the home. So it's just important so that we can protect our children and end this vicious cycle of sexual abuse for children.
And that's what I see. Darkness to light in child sexual abuse.
And under the program of Building Toward Wellness Community Coalition, better known as BTWCC.
Thank you so much for providing this helpful information here in the community, because a lot of people just don't know.
Yes, and that's what we want, awareness. Awareness and prevention.
That's the key.
Prevention is the key.
Prevention is powerful.
That's right.
You're watching Straight Talk. I know it's a health fair, but it is so wonderful. It feels like a family reunion. I just met Felicia Edwards, and this beautiful lady told me that I am always welcome in her home.
Yes.
And she's a supporter of the show. Thank you so much.
Thank you for what you do.
Oh, God bless you. And look at you. You're a volunteer here as well.
I do. I was here volunteering with a program called Connections, doing outreach and peer support. I'm a peer supporter, and what we do is we support people and help them make their goals come to fruition. If they come in and say they want support with overcoming drugs, alcohol, trauma, depression, diabetes, high blood pressure, we are open for them. We have groups. We have a game room. We have a gym. We have a laundry room. It's just a safe place to hang out. We even have a cafe. And guess how much it costs?
How much?
It's free. If you want to reinvent yourself, I do resumes, job readiness, internet job searches. I help connect you with supportive employment. I am your buddy. Whatever you say you want to come in and do, I'm not going to tell you you can't do it. I look up what you need to do it, see where you are, and we help get you there.
I love that. You are a
Nothing is impossible. We have the hookup because we are connections.
Oh, my. So how can people connect with you and find you?
We are located right now at 1727 Boxwood Place. That is on the other side of the library. But we're going to be moving to our new location at 1409 Wildwood Avenue as soon as they get the handicap ramp for me in tip-top shape, and the fire marshal comes out and gives us the okay. We're looking at the next 2 weeks we'll be moving.
Wow.
And Wildwood is right over there across from Popeyes on Winton and around the corner from Chick-fil-A. Yeah, we can smell the chicken from our porch.
I love you, Felicia. Now, you said something that really, really just stuck with me, and I think it's going to help someone. You said that you're not handicapped.
I'm handicapable. I know from what I've been through that there is something that I can do. I have a superpower, and it's my smile.
Oh, and it is so contagious.
It is contagious, and I'm effervescent. And also, I love to help people. My sister said, everybody else is trying to do work from home. Why do you want to go out? I say, because they can't see my superpower over the phone.
Wow, praise God. Oh, we have to support this. It's been a
My
pleasure.
director is Frida Green, and she's on fire. I'm what they call a CARES. It stands for Certified Addiction Recovery Empowerment Specialist, and it's supported by the Georgia Council of Substance Abuse in Atlanta.
Wow.
Yes,
All of
yes.
this here at a health fair, and it's free,
And
freely
I'm
given.
celebrating 9 years of recovery, and I just had a biological birthday yesterday.
Awesome. Congratulations.
Thank you. Yes.
Don't you love her? Oh my God, you need your own show.
I'm gonna leave that to you, but I will support you.
You're watching Street Talk. I am now talking to Sanja and Antonio. They are a husband and wife nurse team. I love that. And let us know what's happening over here when people come here. What are you all are doing?
Well, we're here volunteering with the Tree of Life. We're checking PSAs, which is for prostate. Early detection is always the best. We're also doing vital signs, triaging.
What is that triage?
Triaging is when you get the vitals, such as blood pressure, pulse, oxygen, and things of that nature. Just let the patients know if they're at risk for hypertension or anything like that.
So you can take a blood test to check for prostate cancer?
Yes, ma'am.
And
Yes,
the
ma'am.
actual name is prostate antigen test, and it'll let them know if their levels are elevated. That'll alarm the doctor to go further with the testing.
It's amazing that having simple blood tests and various type of blood tests, how it would detect what's going on in the body now.
And see, early testing is always the best because especially with prostate cancer, you catch that late a lot of times because a lot of men don't go to the doctor and get checked. So having this is a blessing, like you said, because being able to come out here for people with no insurance and being able to get tested, it's a step forward. You're stepping ahead of yourself and able to catch anything that you may have or may not have.
And just to piggyback off that, I'm 40-year-old young man, so men, get out there, get your test and your levels done, so you can know early. You can prevent a lot of
And that's
things.
what I was going to ask you. At what age should men start checking for it?
If they have a family history of it, I would say around 35, but usually around 45.
Yes, we're also checking for blood pressures, for hypertension. That's also actually a silent killer, so that's important to jump ahead of that as well. So,
Absolutely. Well, thank you so much. So it seems like people come over here, they'll sign, and then you shift them on down,
Yes, ma'am.
or you're doing the blood work here.
Blood work here.
Okay. Oh,
And then on the
Checking
floor,
vital
of
signs,
course.
and just about everybody on this row is doing the same thing.
Same thing.
And then if you go on another level, they're checking for something else,
Absolutely.
breast exams and different types of tests. Yes.
all of that here.
Yes, ma'am.
Well, and you're here with Tree of Life Health.
Yes.
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 Awesome. Well, God bless you, and thank you for your service.
Thank you.
You're taking it beyond, your profession, I would say,
Yes.
because you're out here volunteering.
Yes, because this is our passion. So patient care is our passion.
I love that.
Yes.
Patient care. Thank you again. God bless you.
God bless you as well. Thank you.
You're watching this here on Street Talk.